Okay, we are live. Hello, everybody. Thank you so much for joining us today. I'm Deanna Bryan, Program Manager at Hope for HIE, and I'm joined here with Annie Gunning, our Certified Child Life Specialist. Hi, Annie.
Hello, I'm so glad to be here again. Let's
Yes,
do another
thank you.
Q&A.
Let's do it. So this, I told her, I was like, I'm going to try not to say, and I did it within the first minute, Annie.
I'm going to do the
Minute.
same thing. That's
That's
all
okay.
right.
We are going to discuss today how to cope, how to help your kids cope with stress. And we're going to have a general discussion just about stress and how to identify it, what it looks like. And then we are going to separate it between a conversation for stress in a child with medical complexities and then stress in a sibling, if that pertains to in your family. But before we get into all of that, Annie, I would love if you could once again explain what the role of a child life specialist is, number one. And then number two, really how your role and your scope, what your scope of responsibilities are for our organization, Hope for HIE.
Yeah, definitely. Thank you. We've done a couple of these Q&As now on different topics. And like Deanna said, this one today is just to help kids cope with stress, just like we have. But as a child life specialist, that's one of the things that I help kids and help families do is we help kids cope with stressful situations that sometimes pertain specifically to medical experiences. That's been the history of child life. But more and more, we're seeing child life expand into other areas in the community. So we help kids deal with any stressful situations. So identifying those emotions and what can we do to help with them? Big changes, big feelings, anything we can do to help decrease their stress and increase their positive coping. And that goes for the whole family. So when you have one family member who is sick, whether it be a grandparent or a parent or a sibling, it affects the whole family. So we also offer support to siblings, or what I like to call the non-patient. I love supporting the non-patient because it helps the whole, like I said, it affects the whole family. um
No,
See, we're both gonna do
the
it.
issue is that I brought our attention to it. I should have
Yeah.
just not said anything.
So
I
one of
know.
the
I'm
ways
sorry.
that child life specialists typically support kids and families is through education, medical preparation, creative expression, anything that we can do through like a play-based to help them understand what they're dealing with and how to cope with it. And then also I am a certified grief counselor and a certified infant massage instructor. So specifically with Hope for HIE, I've done some virtual support to help families come up with a coping plan because their child is going to be having a new procedure or test that they're not familiar with. So I've talked with a parent or done a Zoom call with the parent, and we've come up with a coping plan so I can learn more about their child. And then what can we do to make this a successful visit, decrease the stress, increase their positive coping skills. And then the same with grief counseling and infant massage. I've also done some Zoom infant massage, across the globe, really, and taught infant massage to a family, and then grief support as well. So those are the ways that I am here for Hope.
And we love having you. And what's so great about you is just the fact that you're so able to curate all of these experiences for families and just make it really individualized and to exactly what they need. So we're really grateful to you. We're really grateful to Child Life on Call for connecting you to us. So thank you. And we can get started I just want to have a general discussion just about anxiety and stress. And I know it's probably different for every family, of course, and how it manifests in children is obviously going to differentiate. But in general, what are some of the signs or symptoms that a child may be experiencing stress or anxiety that parents can look out for?
Yes. And I'm glad you brought that up about everybody's individual needs and everybody's a little bit different, because that was something that I wanted to mention. Well, a lot of this is just going to be general information. If there's a specific situation or event that has happened with your family, please reach out to me through the Hope for HIE website so we can come up with an individualized plan specific to what your family may need. So having said that, moving forward with just some common experiencing what a child may experience stress or anxiety and what those signs are. Younger kids, fussy, not sleeping, or changes in their sleeping pattern. You might see some separation anxiety or regressive behavior, whereas before that was not present. So I do have a family that their mom is ill, so this is a little bit different, but at school they're okay all day, which I think is because it's routine, it's normal, but when they get home, they're seeing a lot of regressive behavior. That's a normal stress response.
Mm-hmm.
Easily being upset or angry, irritable, uncooperative, hitting, kicking, being confused, anxious, yelling, just those behaviors that you normally would not see in your child. Those are different. All of those type of what we would call challenging behaviors, or somebody might say your kid is acting out a lot. That is all your child's way of communicating that they have a need. That is their expression of something is happening, something is going on. I don't really know what it is. I don't know how to deal with it, but this is how they're letting people know that they are stressed out. And even when we're stressed out, we get irritable, we get cranky, we might yell at someone. So kids, that happens with kids too. And another thing just to kind of be aware of, and when we're stressed in our house, kids feel that. So even if maybe something isn't directly happening to them, they feed off of our stress. So any of those things that just are not their normal behaviors, those are signs that they're experiencing some stress or anxiety.
Yeah, especially I think when it comes to different age levels and developmental levels too. Sometimes there just isn't the means or the vocabulary to
Absolutely.
express. So it can have some physical manifestations. And that's something that we're experiencing at home right now too. So I get it.
Absolutely. That's their way of saying, like, screaming, like something's going on with me. So that's when we need to address it. Yep. That's how they communicate.
And as a parent or a legal guardian or whomever is taking care of that child, at what point do we say, all right, this is a stress response or an anxious response, but now it's getting to the point of, do we need to seek specialty or like professional help? So how can you help parents differentiate between those two levels?
Yeah. And I think we all have those bad days or those stressful days or down moments where we have those moments when we're, uncooperative and we're irritable and they kind of come and go. And that's a normal way you would have and deal with stress. But I would say when it's ongoing and it's just continuous, like when you're seeing just that same type of behavior for weeks, months, at that point, it's time to maybe bring someone else in and ask for help. And you can always, some people don't know where to start. You can always start with your pediatrician and just say, hey, I've been seeing these are some changes. This isn't the same. This is a change. Now it's been going on for a month. What do you recommend? And kind of start there. And then if they say, I think you need to go look for a play therapist or, just a counselor or someone, they can kind of help lead you. But I think it's once it's starting to happen for a longer period of time than just every now and then.
Yeah, that makes sense to have it just be a little bit more chronic than something that may be situational or temporary. So as we move into strategies and techniques for coping with stress, especially for children with medical complexities, I would love to know if you could share some age or developmentally appropriate strategies or techniques to help parents with those children when it comes to managing or coping with stress.
Yes, definitely. And some of these, and I think I'll probably go into children with medical complexities and then siblings as well who don't have any type of chronic issues. So you might see some overlap here for sure. But just to start, if we can focus a little bit more on, our kids that have chronic medical issues or any kind of medical complexities. One of the big things that I like to do with any child is just allowing their emotions and validating those, like naming what they're feeling. You are crying right now, and that usually is a sign that you're sad. It's okay if you're feeling sad right now. Just allowing that emotion to happen and validating what it is. And then we can feel sad. We don't have to fix it. We don't have to make it go away. We don't have to make it better. Just let them have that moment, acknowledge, hug, read a book, and then you can move on. But it's okay to let them have that moment. This is especially important with the really young kids, like teenagers. you can study like, hey, you seem really mad. Like I can tell by the look on your face, you're mad. Do you want to talk about this? Or do you want to go call a friend about it? But still acknowledging it. It's, obviously different with the age groups, but still with the younger kids, helping them really identify what their emotion is with the event is important. And then allowing space for de-escalation and suggesting some strategies. So if they're in that moment, sometimes you can't get them out of it, like they're in it and there's no talking to some kids, right? Like you can't, and that's okay.
Yeah, we call it the red zone in our house.
And that's exactly what it is. It is definitely like, don't reason with them. Don't try and negotiate because it is not going to happen.
It's not going to work.
No, not going to work. Meltdown and we'll regroup after, but come back to it after. Come back to it after. And again, you were really mad and you were hitting and kicking and that part isn't okay. Next time when you're really mad like that and you feel your body tight, you can go punch a pillow in your room, or you can hit the stuffed animal, or, whatever your other strategy would be. But breathing strategies, calming strategies, the one that, the hand breathing is always a good one. I always tell kids, you always have your hand with you. So if you need that reminder. And then I do have a great book, and I don't know if I put it on my resource list or not, but it's called Breathe Like a Bear. And it has great breathing techniques. Like some of them are to help with focus. Some of them are to energize, to relax, to calm. Like I think there's 5 different sections, but it's great. And I do it with a lot of groups, but it's a great book and it has pictures and it goes through different things. So that's a great one.
Yeah.
That can be
I will be adding that to my Amazon cart like the second we're off this conversation.
Good. Yeah, it's awesome. Like I use it a lot. And then just a quiet space with materials. Maybe you have a quiet corner in your house and you have a little box in there that has a little book or a notebook with some colored pens, somewhere where they can go by themselves and just kind of draw and scribble, or maybe they just have a room that they go to by themselves and they need to watch something quietly, just away from everybody, away from the stimulation. Maybe they need some fidget toys, just give them that quiet space and then some materials to use in that space. And stretching's always good. Tighten your muscles, loosen your muscles. Really Another one is identifying strengths. It's always good to remember the things that we're good at, the goals that we have, but identifying those strengths is really a confidence builder in kids. So that can just help with managing any kind of stress. Remember, you're good at this and you did this before, and just reminding them of their strengths and having them identify. And kind of along the same lines as making a gratitude journal or jar. You can do this as a family or individual. What is one thing you're grateful for today? It doesn't have to be big. It can be that, you had your favorite stuffed animal, you were holding it when you woke up in the morning. I'm so grateful I had that. It can be something tiny, but have that a jar with little papers and everybody writes something on it. But just that reminder that there's always something little. It doesn't have to be big.
Yeah.
And then preparing for any changes or upcoming doctor's appointments, tests, things like that. That preparation for some kids is key to decreasing their stress. And for some kids, it's a week before. Like if they're older, it's typically like, they can handle it anytime. But preschoolers, it's like maybe the day before. Or maybe, as they get a little bit older, you can kind of extend the time out. But some kids are different. I've had like a middle school kid that she wanted to know the morning of, not right when it was happening. She didn't want to know the night before because then she'd be too worried. So find out what that is for your kid, but prepare them for what appointment it is, what's going to happen, who they're going to see, who's taking them, what is changing in their schedule that day.
Yeah.
Are they leaving school early? Are they staying home? Anything that's going to help them prepare for that day will decrease that stress of the unknown. That's usually what creates a lot of stress, especially around kids who have a lot of doctor's appointments or medical things that, bring on that anxiety and stress.
Yeah.
Using a timer to prepare for day-to-day transitions. I find this really helpful with some kids I see, even when I'm transitioning between activities, just doing like, hey, we have 5 minutes and we're cleaning up, like does not work. I need an actual timer with a song or something on it. And you can make it a song, on your phone. Like I use my phone timers, but just that timer to help with that. So you get that note that, oh yeah, I have to transition. Free play and creative expression, allow time for that. Everything isn't scheduled, just that free time. Here is some materials, here's some sand, here's the kinetic sand. I know it's messy, a lot of people don't like it. I like messy stuff. I'm a huge fan. It just gives them that freedom to play and build. Kids need that. They process, they learn through that. They process, that stress. So they do need that just open kind of free time where they get to do what they want.
Yeah.
Animals, of course, are great stress relief. Snuggling and cuddling animals. If your kiddo really loves animals, you can go to like live stream animals on YouTube, or I think it's explore.org.
Yeah.
And
you mentioned that one before.
Yeah. And then you can live stream different animals, like doing stuff out in nature, which is pretty cool. And I think for some kids, that's like relaxing and too. Get in their world and play basketball, pretend play, video games, whatever you want to do for that 15 to 20 minutes. And I have this as a resource, but I wanted to show you as well. These are called, can you see that?
Oh, yes.
Special time cards from Mighty and Bright.
Ooh.
And what you do is you name your time, like you name your time together, like it can be unicorn playtime, whatever your time with your child is. You time it and it's 15 to 20 minutes. So you set that timer, it's 15 to 20 minutes. Everybody knows it's 15 to 20 minutes. But then any device, phones, that's set away. You pick one of the cards. There's all different cards.
Oh, I love those.
See?
Yeah,
so there's different ones. There's like, there's like creative, there's active, there's games. So like there's building, like different ones. It's child-led, so you're just in it with them. That. And when the timer goes off, then we're putting it away and we're done. But you've spent that 20 minutes or 15 minutes of undivided time with them. And that, other than just 5 minutes and you're trying to do other things, can be really beneficial and helpful. And then they can continue to play. But, the expectations are set at the beginning. So, and I think we have this as a resource that we're going to post too.
Oh, yes. And we'll include this on our blog. We'll include it on the key takeaways, the whole thing. Those are really amazing suggestions. And they all seem really versatile, which I love because, as you know, like stressful situations change and it just depends on what's going on in your life. And it feels like a lot of those can be reused or repurposed for those situations. So that's really nice.
Yeah.
Now, I know you said that there might be some overlap when it comes to strategies or techniques to help siblings of medically complex children cope or manage stress. So it's okay if you repeat some of those things, but are there some other techniques or strategies that are a little bit more tiered to those siblings?
Yeah, I think there definitely are some for sure. And one could be maintaining the routine. So when you do have a child who is in the hospital or is in some type of a treatment or they're having a surgery and they're going to be gone, maintaining that routine for the sibling at home is going to help decrease that stress. So as best as you can, some things will be changed, some things will be a little bit different, but as much as you can maintain their routine and then leading into that, preparing them for that. I'm going to be taking, your brother to the hospital on Tuesday. We will be there Tuesday, Wednesday, and Thursday. But this is who's picking you up for activities. This is who's giving you dinner. Like letting them know who is going to be caring for them and what their days still will look like. Because otherwise, that can be very stressful for some kids, not knowing, especially if they have a sibling who has a lot of frequent, hospitalizations and visits. That can be very unsettling. So just making sure that they know. And this is one of those things too that I mentioned. If you have a specific situation like that in your family or something like that is coming up and you need more individualized plan, please reach out to us. We're happy to help with that. And then again, I have the special time cards. And then helping your siblings identify like other family members or friends who can be supportive and helpful. And making sure those people know too, hey, we're going to be gone for a couple of days or we have a lot of appointments this week. Can you just check in with them and make sure, like maybe that's their person. Maybe grandma is their person. And just kind of making sure that they have that connection. any kind of comfort items, and this, really goes for both. Like, what comforts you? Let's think of all the comfort things you have. What does comfort smell like? What does it taste like to you? What does it feel like to you? What does it sound like? Just helping them identify all of those comfort things around that they have, that even if things change a little bit, those things are still around. And then allowing opportunities for emotional expression. So creating a space without any judgment and allowing them to have those moments. And you don't have to fix it. You can just be holding quiet space is actually hard for a lot of people, but sometimes you don't have to say anything, especially for teenagers. You can just be there and it can just be quiet, and eventually they'll say a few things. So try it. It's a little hard, but they will. You'll be surprised with what they share, especially in the car rides. And then other things to help with just kind of some effective coping, like art, journaling, cooking, being outside, building stuff, making Play-Doh and adding some sense to it, like put colors in it, put some sense in it, like peppermint or lavender, and just letting them kind of build and create, offering those opportunities for just like creative expression that they normally wouldn't be doing. And maybe they want to incorporate their sibling, or maybe they just want to do it by themselves. But those opportunities for just, unscheduled creative time are really important. Of course, eating well, getting enough sleep, those, right? We all need to do that.
I was going to say, I think that's like everybody.
Right?
Right.
And then move around, play a sport. The All Trails app, grab a family member and go for a hike, or grab a friend or a neighbor and go for a hike. But just moving around and getting that exercise and kind of reminding them that it's all connected. What else do I have? The mini goal setting, the grounding exercises too. So mini goal setting, just mini goals for the week. What are your goals you want to reach this week? And then grounding exercises just help you to be present. Think of 5 things you can hear, 4 things you can smell, 3 things you can see, 2 things you can taste, 1 thing you can, what did I leave out?
See? Oh gosh. See, taste, smell, touch, hear.
1 thing you can hear. So those grounding exercises can be helpful. Like, just let's take a minute. Let's just be right here. It just kind of helps you, and you have to practice it, but that can be really effective. And obviously it's different for different ages, but try it for like 2 minutes. You can start with 2 minutes. So those are some.
A lot of these strategies that you're talking about, I know, are also going to be available in our Super Sib packet that are going to start to go out in January. We'll start promoting that again more. But it's essentially strategies and activities and games to help celebrate a lot of siblings of those with medical complexities, or even siblings who are dealing with loss of a child with a medical complexity too. So a lot of these resources are made. So when we do share this on our social media channels, I can always try to include links to that grounding exercise that you came up with, Annie, and stuff like that, because I think that would be really helpful to have like a set of directions for parents and kids as they go through this. So, which is a great segue actually into, are there other just tools or resources? I know you gave us so many wonderful strategies and techniques, but are there places or parents can go to, like websites or any other resources that you would recommend, who just, they want to further educate themselves on this topic of navigating stress or coping with stress and managing it with their family?
Yeah, so I do have a couple of things. I have a huge list of books here, which we will post and add to our resource list. So I have books from like the really young kids, like The Rabbit Listened and My Many Colored Days, which just talks about feeling identification. And then we have some sibling books. The Sibling Slam book is a great sibling book that just kind of gives you that connection that siblings might have. And then Ink About It by Art with Heart is a great older kid book. So I do have a big list, but again, if you have a specific situation, let me know, because I only included a small list, but I have a lot of really great books that I love to use. And Mighty and Bright, which I said was those special time cards. I love also the idea that they have is the calendar with different pictures of the week of things that are happening. Like this is a school day, whatever is happening in your family each day. This is a day for the hospital. And it just gives the kids that visual of the calendar. So, and I know I've used Mighty and Bright before, and I promise I don't work for them. I just love their resources. They're
Shameless plug,
really
yeah.
sweet and really helpful.
Yeah.
So they have great calendars, but you can make your own little calendar with pictures. But I think the visual is the important part, the visual calendar. And then the Child Life on Call app. So as a Hope for HIE community member, all of our families have access to the Child Life on Call app. And that app has tons of resources for families regarding hospitalizations, procedures, and tests that are coming up. It has something that you can make individualized for a coping plan for the hospital. So it does have tons of resources. And then we do have a way that, how you can log on and get that app that we can share too. But
yes,
I just wanted to make sure you all know that it's a wonderful app and a great resource, because it's really geared towards parent advocacy, parent empowerment. And obviously that's key when we're trying to help our kids decrease stress.
Yeah.
And then I think, lastly, one really great one for little kids is sesameworkshop.org. They have great videos and resources for kids, like a short little 2-minute video. But they also have just a lot of written materials that are really helpful for our younger kids.
Yeah. So we have a few comments coming in, and a common thread that's unifying them together is really, as a parent, they're saying, dealing with these reactions and stress of my kid is stressing me out. And it's been challenging, it's caused, issues for me too. So I know this wasn't something that we originally planned on talking about, but do you have is there anything that comes to mind that, like, advice or a strategy for a parent to kind of help alleviate their stress as they are themselves managing the stress of their children?
Yeah, definitely. Like a parent dealing with their own stress, right? As they're dealing with the stress of their kids. That's what you're saying, correct?
Yeah.
Yeah, definitely. I think one thing that, and I have learned a lot, is it's okay to tell people what will help you, and it's okay to say no. So I don't know specific situations on what the stressful situation is, but if it's related to like a medical thing that you're going through, or something around the hospital, or something like that, like advocating for, yourself, just as you would your child, like, no, I cannot do that. And I'm not doing that. It is okay to not do everything. What you're doing is enough. You are doing amazing things. I just feel like it's hard for parents to kind of, you and I are both parents too.
Yeah.
We deal with it every day too, but having people help you, rely on those people, because if people asked you for help, you would want to help them. So I really truly believe that people around you want to help you, let them help.
Yeah. And like you said too, I mean, all of these resources like the Child Life on Call, I mean, and just talking to you and going to HIE.support as well, like, this is a whole family approach. So you can, as if you're a parent and if you're struggling with stress, whether it's situational or if it's just the stress of seeing and like living with the stress of your kid and what they're going through, there are resources to help them too, right? It's not, like you said, it's not just for children. This is for the whole family.
100%. Yes. Please reach out to our website. We have like peer support groups for all of our families. I am here to help talk through any situation of what's going on, to help come up with something that could be beneficial. Maybe there's just little changes that we can put in place that might help decrease stress in the family. And because it's just one thing. And we have Haley too, our social worker.
Yeah.
And we can help find resources in your community. So we're all over the place, but we have access to, be able to find resources that are close to you. And we're happy to help do that.
I love that. Annie, I think that concludes our session for today. Thank you so much for taking the time. And we're so excited to just put this as just another wonderful resource on our Child Life EQ here. So all of these videos will be under the Child Life Q&A section on our YouTube channel. We have some wonderful printable resources that we've created in the past that we're going to be uploading onto our website with regards to what we've spoken about with Child Life on Call and Child Life Q&As in the past. So thank you for everyone for tuning in. And Annie, like you said, if there is a question or a concern or situation that pops up, go to hie.support. You can get in touch with Annie, our certified child life specialist. You can get in touch with Haley Thomas, our social worker, and please take a look at Child Life on Call. We will give you all of the sign-up information at the end of this video and on all of our social channels. Thank you so much, Annie, and we will see you very shortly next month. I think we're going to have a conversation about dealing with navigating school during hospitals and recovery time. So we can look forward to that.
Yeah. Thank you so much. Thank you all for joining.
Thank you.